For decades, we've been conditioned to believe that more medical testing equals better health care, especially as we age. But what if I told you that after 75, some of the tests your doctor routinely orders might actually be doing more harm than good? I'm here to share what decades of medical research have revealed about 7 common tests that lose their value and can even become counterproductive after age 75. The medical community has been slow to acknowledge this reality, but the evidence is mounting. When we reach our mid-70s, our bodies operate under different rules. Our life expectancy, treatment tolerance, and health priorities shift dramatically. Yet many physicians continue ordering the same battery of tests they would for a 50-year-old, often leading to unnecessary anxiety, invasive procedures, and treatments that may reduce rather than improve quality of life. What makes this particularly troubling is that these tests aren't just wasteful. They can trigger a cascade of medical interventions that become increasingly dangerous as our bodies age. A false positive result can lead to biopsies, surgeries, or aggressive treatments that a 75-year-old body may not handle well. Meanwhile, the conditions these tests aim to detect often progress so slowly that they're unlikely to affect someone's remaining years significantly. The first test that loses its value after 75 is routine mammography screening for breast cancer. Major medical organizations, including the American Cancer Society, have moved away from recommending automatic mammograms for women over 75. The reasoning is compelling. Breast cancer tends to grow slowly, and the cancers detected in women this age are often so slow-growing that they would never become life-threatening within the woman's remaining lifespan. Consider the mathematics of screening at this age. The average 75-year-old woman has a life expectancy of about 12 years. Most breast cancers detected through mammography in this age group are small, early-stage tumors that might take 15 to 20 years to become dangerous. This means the woman is more likely to die from heart disease, stroke, or other age-related conditions than from the breast cancer the mammogram detected. But the real problem isn't just the unnecessary detection. It's what happens next. A suspicious mammogram leads to additional imaging, biopsies, and often surgery. These procedures carry risks that increase with age. Anesthesia becomes more dangerous, healing takes longer, and the stress of cancer treatment can accelerate cognitive decline and reduce overall quality of life. Many women who undergo breast cancer treatment after 75 report that the cure felt worse than the disease ever would have. The second problematic test is routine colonoscopy screening for colorectal cancer. While colonoscopy is excellent for preventing colon cancer in younger adults, its risk-benefit ratio shifts dramatically after 75. The American College of Physicians now recommends against routine colonoscopy screening in adults over 75, and the evidence supporting this position is robust. Colorectal cancer typically develops over 10 to 15 years, progressing from small polyps to invasive cancer. For a 75-year-old, even if polyps are found and removed, the benefit in terms of life years saved is minimal. Meanwhile, colonoscopy becomes increasingly risky with age. The bowel preparation can cause dangerous dehydration and electrolyte imbalances in older adults. The procedure itself carries risks of bleeding, perforation, and cardiovascular complications that are significantly higher in patients over 75. I've seen too many cases where a routine colonoscopy led to complications that resulted in emergency surgery, extended hospital stays, and permanent changes in bowel function. For many patients over 75, the quality of life impact from these complications far outweighs any theoretical benefit from cancer prevention. The third test that becomes questionable after 75 is routine bone density screening for osteoporosis. While osteoporosis is certainly a concern in older adults, the value of repeated DEXA scans diminishes significantly after age 75, especially in patients who have already been diagnosed and treated for osteoporosis. The problem with continued bone density testing at this age is that it rarely changes treatment decisions. Most 75-year-olds who are at risk for osteoporosis are already on appropriate medications and following bone-healthy lifestyle practices. Additional DEXA scans are unlikely to reveal information that would alter this approach. Moreover, bone density scores can fluctuate based on positioning, machine calibration, and other technical factors, leading to unnecessary anxiety or inappropriate medication adjustments. Instead of focusing on bone density numbers, the emphasis after 75 should be on fall prevention, maintaining muscle strength, and ensuring adequate nutrition. These interventions have more immediate and practical benefits for preventing fractures than obsessing over small changes in bone density measurements. The fourth problematic test is routine prostate-specific antigen screening for men over 75. The PSA test has been controversial even in younger men, but after 75, most major medical organizations recommend discontinuing routine screening altogether. The reasoning mirrors that of mammography. Prostate cancer typically grows slowly, and men over 75 are more likely to die with prostate cancer than from it. Elevated PSA levels in men over 75 often lead to prostate biopsies, which carry risks of infection, bleeding, and urinary problems. If cancer is found, the treatment options, surgery, radiation, or hormone therapy, all carry significant risks and side effects that can dramatically impact quality of life. Surgical complications increase with age, radiation can cause bowel and bladder problems, and hormone therapy can lead to hot flashes, muscle loss, and cognitive changes. Many men who undergo prostate cancer treatment after 75 experience urinary incontinence, erectile dysfunction, and other complications that significantly reduce their quality of life. Meanwhile, the cancer they were treated for might never have caused problems if left alone. This is why informed medical decision-making after 75 focuses more on managing symptoms if they develop rather than screening for asymptomatic disease. The fifth test that loses value after 75 is routine cardiac stress testing in asymptomatic patients. While heart disease remains a leading cause of death in older adults, stress tests in patients without symptoms rarely provide actionable information and often lead to unnecessary interventions. The problem with stress testing in older adults is that many will have abnormal results simply due to age-related changes in the heart and blood vessels. These abnormalities don't necessarily represent dangerous blockages that require intervention. However, abnormal stress test results often lead to cardiac catheterization, a procedure that carries increased risks in patients over 75. Cardiac catheterization can cause kidney damage, bleeding, stroke, and heart attack, complications that occur more frequently in older patients. If blockages are found, the subsequent treatments, stents or bypass surgery, also carry higher risks in this age group. Many cardiologists now recognize that the risks of these interventions may outweigh the benefits in asymptomatic patients over 75, especially those with other health conditions that limit life expectancy. The sixth questionable test is routine cervical cancer screening with Pap smears in women over 75. Most medical organizations recommend stopping Pap smears at age 65 if a woman has had regular normal screenings. Continuing this testing after 75 provides minimal benefit, while potentially causing significant anxiety and unnecessary procedures. Cervical cancer typically develops slowly over many years, and new cases are rare in women over 75 who have had adequate previous screening. When abnormal Pap smears do occur in this age group, they're often due to age-related changes or inflammation rather than precancerous conditions. However, abnormal results still trigger additional testing, including colposcopy and biopsies, which can be particularly uncomfortable and anxiety-provoking for older women. The final test that becomes problematic after 75 is routine thyroid function testing in asymptomatic patients. While thyroid disorders can occur at any age, screening asymptomatic adults over 75 often creates more problems than it solves. Thyroid hormone levels naturally change with age, and what might be considered abnormal in a younger person may be normal for someone over 75. Additionally, subclinical thyroid dysfunction, slight abnormalities in thyroid function tests without symptoms, is common in older adults and rarely requires treatment. However, abnormal thyroid tests often lead to unnecessary medication prescriptions or inappropriate dose adjustments of existing thyroid medications. Thyroid medications can be particularly tricky in older adults. Too much thyroid hormone can cause heart rhythm problems, bone loss, and anxiety. Too little can worsen fatigue and cognitive function. Many older adults do best when their thyroid function tests show values that would be considered slightly abnormal in younger patients. Now, I want to be absolutely clear about something important. I'm not suggesting that people over 75 should avoid all medical testing. What I'm advocating for is smarter, more individualized testing that considers the person's overall health, life expectancy, and personal values. Some 75-year-olds are in excellent health with many active years ahead of them, while others may have multiple health conditions that significantly limit their life expectancy. The key is having honest conversations with healthcare providers about the goals of testing. Is the test likely to find something that would change treatment decisions? Are you prepared to undergo the treatments that might be recommended if abnormalities are found? Do the potential benefits outweigh the risks and anxiety that testing might create? Consider Maria, a 78-year-old woman I know who had been getting annual mammograms for decades. When her new doctor explained that continuing mammograms at her age was unlikely to benefit her and might lead to unnecessary anxiety and procedures, she felt relieved rather than concerned. She had been dreading each mammogram and the weeks of waiting for results. Stopping routine mammograms allowed her to focus her healthcare energy on managing her arthritis and staying active, priorities that had much more impact on her daily quality of life. Or think about Robert, an 80-year-old man whose PSA levels had been slowly rising. His urologist recommended a prostate biopsy, but after learning about the risks and limited benefits at his age, Robert chose active surveillance instead. 3 years later, he remains symptom-free and has avoided the complications that many of his friends experienced from prostate cancer treatments. The medical approach for people over 75 should focus on maintaining function, managing symptoms, and preserving quality of life rather than detecting and treating every possible abnormality. This doesn't mean ignoring health concerns. It means being more selective about which battles to fight. When symptoms develop, appropriate testing and treatment become much more valuable. A woman who develops a breast lump should certainly have it evaluated, regardless of her age. A man experiencing urinary symptoms might benefit from prostate evaluation. Someone with chest pain or shortness of breath needs cardiac assessment. The difference is testing in response to symptoms versus screening asymptomatic individuals. This shift in approach requires a change in mindset for both patients and healthcare providers. We've been conditioned to believe that more testing equals better healthcare, but after 75, the opposite is often true. The art of medicine lies in knowing when to act and when to watch, when to intervene, and when to provide comfort. Healthcare providers need to become more comfortable having conversations about life expectancy and treatment goals. These discussions aren't about giving up hope. They're about focusing medical efforts where they can do the most good. A 75-year-old with diabetes and heart disease has different priorities than a healthy 55-year-old, and their medical care should reflect these differences. The financial implications are also worth considering. Medicare and other insurance plans spend billions of dollars annually on screening tests that provide minimal benefit to people over 75. These resources could be better directed toward services that truly improve quality of life for older adults: physical therapy, nutrition counseling, mental health services, and home safety evaluations. Perhaps most importantly, avoiding unnecessary testing can reduce the anxiety and medicalization that often plague older adults. Many people over 75 report feeling like they spend more time in medical offices than enjoying life. By focusing on truly necessary care and avoiding marginal testing, older adults can spend more time on activities that bring joy and meaning to their lives. The message here isn't pessimistic, it's liberating. Reaching 75 doesn't mean your health doesn't matter. It means your health priorities should shift toward maximizing function and quality of life rather than detecting every possible problem. This approach often leads to better outcomes and certainly leads to less anxiety and medical intervention. If you're over 75 or have loved ones in this age group, I encourage you to have open conversations with healthcare providers about the value of routine screening tests. Ask about the likelihood that testing will change treatment decisions. Discuss your personal health goals and values. Don't be afraid to decline tests that seem excessive or unlikely to benefit you. Remember, good health care after 75 isn't about avoiding all medical care. It's about being thoughtful and selective. Focus on managing symptoms that affect your daily life, staying active and engaged, maintaining social connections, and enjoying the wisdom and freedom that can come with age. Sometimes, the best medical decision is the one that allows you to spend less time worrying about theoretical health problems and more time living the life you want to live. The goal of healthcare at any age should be to help people live their best possible lives. After 75, this often means choosing quality over quantity when it comes to medical testing and interventions. It's never too late to take control of your healthcare decisions and focus on what truly matters for your well-being and happiness.